This is my first episode 4 years ago. I have had 2 reoccurrences due to a virus and sinus infection. Do you have recommendations to prevent recurrences or to recover faster when they happen? Thank you. It's a very insightful question. Thank you very much. As reoccurrences of facial palsy do not happen that often, it is very seldom actually. Well, virus, if it is residing in your body and if it has already been active, then the best recommendation which I can do is to maintain your body powers at the proper level, which means that take good care of your body, especially control your stress levels, control your physical exhaustion, control your exposure to direct cold, like when it is winter. And if you're living, I don't know from whom is the question, so I cannot tell. When you go out, take a hat, take a shawl, and then go. If you live in the hot areas, watch out for the air conditions. I don't mean that you have to run away from the air codes. No, but when it's very hot outside and you come to the air-conditioned compartment, don't stand under the air conditioner and let it blow in your face. A couple of days ago, I Zoomed with a patient from Saudi Arabia who once was very healthy, no problem. She was once in the shower, very hot, and then she opened the freezer and started to massage her face with a piece of ice. She did it for a few minutes until she started to feel it. It's like a burning. And of course, after that, she developed not the facial paralysis total, but the weakness of certain facial muscles, which I assume was due to prolonged effect of the concentrated cold affecting her facial tissue. So just use your regular common sense and due diligence to facilitate the recovery after the reoccurrence. God forbid that it happens, but if it does happen again, first of all, go to your doctor, take your medication, start immediately with antivirals and steroids. These 2 medications are medications of choice. Some doctors are reluctant to prescribe antivirals unless there is a visible rash, but still, in my opinion, not every time when virus is the cause, visible rash is present. It could be other type of virus, and it could be inflammation not on the ear, but sometimes behind the ear. So it is always understandable to take antiviral medications. It's better be safe than be sorry. And that is why, of course, also if there is no acute pain, if there is no inflammation, there is no swelling of your facial area or your ear area, and again, if there is no pain, you may apply dry heat and do self-massages to facilitate the blood circulation, to facilitate all the processes to do that. If there is pain and rash and swelling, then maybe it is a good idea not to be very intense with your heat application, because that can exacerbate the viral infection.